Hello and welcome everyone to our next session. My name is Sadia Beg, and I am the Programs Coordinator within the Ontario Mississauga branch. I want to thank you all for joining this session on empowering yourself through peer support. Before we begin, I'd like to review with you how to participate. We are offering this session bilingually using simultaneous interpretation. During the presentation, speakers will present in English. To hear the presentation in your preferred language, choose English or French as your language preference in the interpretation icon in the Zoom toolbar. We ask that you enter any questions you may have throughout the session into the Q&A pane at the bottom of your video. We will collect your questions, and at the end of the presentation, our speakers will address as many as they can. You'll also have an opportunity during the Q&A period to ask questions live as time permits. Please feel free to send any further questions to kidneyprograms@kidney.ca. For general comments during the session, there is a feed loop chat box at the right side of your screen. Please avoid using the chat box for questions. They must be submitted again through the Q&A pane to be seen and addressed by our speakers. The information shared in this session is not intended for medical advice. We do recommend that you speak to your doctor and your own individual situation. I would now like to give it to our moderator for today's session. Very honored to have him join us, Dan Slater. Over to you.
Thanks so much, Sadia. Hey, everybody, I'm Dan. I'm a transplant patient, and I'll be your moderator for today's session. So in this session, I'll be joined by some amazing speakers who will speak to their experiences with the Kidney Foundation, Kidney Connect peer support program, and the benefits of receiving these peer support and how it can truly empower them, and actually not only them, but the persons receiving the care and supporting those people. It also supports family, the living donors, pretty much everybody. So it's really exciting that we get to talk about this today. It's going to be a fireside chat. So we're going to keep it pretty loose. We're going to ask real people, real questions, and really get to the bottom of, how this can really help people. We'll also touch upon about how you can volunteer with the program and give back with supporting others through your own lived experience. That's whether you're a patient or a caregiver or a donor or a practitioner, everybody's invited. Also, to add to what Sadia was saying, we don't give medical advice here. We talk about a lot of things. We have a lot of actual information from what we've been through, but none of us are doctors. None of us are, part of the medical team. So anything you learn from this, make sure you go back to your doctor and your care team, because we're all different. We're all part of our own kidney journey, and it's really important that you get the best information for you specifically. Before we officially start our conversation, I'd like to welcome our speakers quickly and then get into the fireside chat with our questions on why peer support. So today we have, I want to welcome first our two patients, Richard and Loy. Just wave your hands so we know who you guys are. Thank you both for joining. Our third speaker is Irma, who's a caregiver to her late husband, Bob. Give us a wave, Irma. And lastly, we have Anam and Olga, who is a renal dialysis nurse in the Best Start program. They see and understand the value and connect others to peer and support. So once again, thanks to all our speakers for being here and joining us and for sharing their thoughts and their lived experience. Let's get to our first question. So Richard, I just wanted to ask you the simplest question. Why choose peer support?
Well, that's a great question, Dan. And it's a pretty important one by all measure. My experience joining peer support goes back many decades, and I first joined peer support unknowingly when I was approached by someone in Toronto as a kidney transplant patient way back in the early 2000s. In that time, I've sort of grown with the peer support program. I've discovered it over time, and I have learned that the number one message that you get from peer support is you're not alone. You're not an island. You're not experiencing all of these kidney things, your kidney journey by yourself. And even after all these years, I still marvel at how much there are still stories to share and people to discover and stories to discover. So if I were to give the number one reason why I would join peer support, or I would recommend someone else to join peer support, is to become part of a community that lets you know that your struggles are not your own. They're for everyone to share, and there are resources out there to help you. So that would be my number one reason to join peer support.
That's great. I mean, you bring up some really good reasons, and obviously from such a personal experience, it's always great to hear those things. Loy, do you have anything to add to that? And also, I'm kind of curious about how you first heard about peer support, and then what led you to join.
Yeah. So just quickly, my kidney journey started about 5 years ago. I joined a clinic called the Multi-Care Kidney Clinic, and that's where I had the opportunity to see a nephrologist, social worker, nurse, pharmacist, dietitian, and to kind of help with my kidney situation. And it was through there, the social worker that I was seeing on a regular basis, I was having some big emotions, and I was sharing with her that, I'm the only one that I know that has kidney disease. And she's, well, that you don't have to feel alone. We do have peer support in a group setting that could help you. And so that's how I first heard about the Kidney Foundation Peer Support Program. The coordinator did call me, and at that time, with all the things going on, and I'm on the cusp of starting dialysis, I just wasn't ready quite yet to start participating in peer support. It wasn't until I started dialysis, probably 6 months later, and got the hang of things with dialysis. I did PD dialysis at home using the machine overnight. I started feeling pretty good about my situation. I felt there was a lot more predictability with what was going on. And the coordinator at the Kidney Foundation called me again, and we had a more enlightening conversation, I would say. And I was very moved to hear about her story. And I felt like now's the time for me to join peer support. And I also felt like I could add value in sharing my kidney journey to others, and also learn from others' kidney journeys as well. And since then, I've participated in sharing my story. It's posted on the Kidney Foundation website. I've also done some multimedia stuff where I've shared my kidney journey through the newsletter. And there was a video made as well showcasing how I was able to thrive while on dialysis. So I'm a big advocate of outdoor activities. And for me, it's camping. So that's a little bit about the peer support journey I've been on.
That's great. And kind of just a question, do you wish you had joined earlier, or do you think that was the perfect right time for you to join?
Yeah, there's parts of me that felt like I should have joined earlier, but emotionally, I just don't think I was ready at that time. To unpack a little bit about how I was feeling before I joined, because I didn't know anyone, it was just, I felt overwhelmed. I'm about to start dialysis, and I'm finding out dialysis is for life. I'm finding out a lot about my condition. It's accelerating in terms of it was going downwards. And so at that time, I just wasn't ready. And yeah, so I would say that when I did finally join peer support, it was the right time for me. And I was able to go in, 2 feet and contribute and learn from others as well.
And Richard, would you say that's the same for you?
I would, in the sense that, I had the benefit of discovering the Kidney Foundation Peer Support Program a long time ago when I was a patient, and sort of drifted into the experience gradually over time. But I would argue that whoever decides to join, no matter who you are, how late you join, chances are that whenever you did take that leap to join a community of people with kidney disease and to talk about your kidney disease with others, is probably the right time at that time. Your own feelings will guide you to when you're ready to do something, become part of a bigger community. So I guess my right time was at the time years ago. But and of course, if you're not comfortable joining a group, a peer support group, that's okay too. I don't want to give the impression that it's a must. But if you're experiencing a kidney journey and you would rather do it mostly by yourself, maybe with the help of your family or close friends, and that's it, and that's fine too. I just found, speaking personally, that being part of a larger community has really helped me a lot over the years.
Yeah,
Yeah.
it's here if you need it, right? It's, I think that's really well put. I'd love to hear from, and this kind of threw me in the introduction, by the way, but Irma, or Ducky, as I know you. I was like, who is this Irma? Maybe we'll start there. So you're a caregiver to your late husband, Bob. So you've been involved for a while and you're still involved. So I'd love to know, why did you first reach out for support, and how did that look for you?
Well, I looked out for it one day when we were at the dialysis unit, and I just felt not overwhelmed, but I needed somebody else, somebody to talk to. My husband could be, you do whatever you want to do. He didn't want anything to do with it, very private person. And so the social worker was there on the unit, and I started talking, and she gave me this number, and it's been wonderful ever since. And they care, they give you time, whenever you can phone whoever you like. And I'm on a few of the peer groups to follow their journeys and to give anybody advice on our experience going through peritoneal dialysis and how it suited our lifestyle. We back in the day, didn't even have a choice what we wanted. Our nephrologist knew our lifestyle and guide us. So that's why right away Bob went on peritoneal dialysis, and 6 years later, and it's just, you learn so much. I'm actually learning more as I talk to the different groups and follow their journeys. And it's like the other guys said, it's just, they're there if you need them, which I still feel I do need that support. And I can't mention any names, but the team is really wonderful. And I just like to enjoy and just help anybody that I can in that way. So yeah, it's all good.
Yeah, that's really wonderful. What kind of ways does that support come to you? Like, are they, I know there's peer groups and one-to-one and that sort of thing. What have you found helpful?
Just learning too a lot and following the journeys, like one that I followed for quite a while, and they're doing so much better. And back in the day when I was nursing, we worked 7 days in a row, and patients were in a lot longer, and to see their development, like getting better each day on the surgical floor. So it brings back that kind of thing too, to follow monthly things to see how everybody's doing. And I just so interested in seeing how they progress and do. And we have a good time with the meetings. So what can I say? Yeah.
I think that's an important point. And that's maybe the surprising thing for me starting to join, is that they are a lot more fun and silly, and you get to know specific personalities and you make friends. And I think I went in with questions about kidney disease, and I came out with a lot more.
Oh yes, it's so enlightening, and I'm so glad for them. And now, and just I'm keeping at it, and there's an extended the exercise program too that's on twice a week, and anybody can join. But they're great. They're great with doing the stretching exercises for kidney patients, but for caregivers too. So you can get involved with a lot of things through the kidney group.
That's great. And I hear there's some stretching later, but we're not going to talk about that just yet.
It's a
Uh,
workout. It is a workout,
is
I'll
it?
tell you.
Okay.
Yeah.
I've been sitting here for too long. I need to stretch my legs, but
Oh, okay. Well, stand
thank-
up.
yeah, thanks, Becky. Appreciate it.
Yeah.
Bob, I'd love to move on to you. So, Bob, for anybody who didn't get it in the introduction, he is a kidney donor and donated his kidney anonymously. That's correct, Bob. And,
Yeah.
I think we can all, as kidney patients, and, hopefully other people too, just obviously what an amazing thing to do. Just obviously very selfless. And so, you have a different outlook on the kidney program, like you come from a different side than us. So I guess I kind of wonder, why did you choose to volunteer with the Kidney Foundation after donating? Because I mean, I feel like donating is the act at first, and then you want to keep giving. So what made you continue on with the Kidney Foundation?
Well, I guess there's two key things that encouraged me to volunteer with the Kidney Foundation. One is, believe it or not, and it's hard for me, it is to express it, and I hope I can do it well. After donating, I couldn't believe how easy it was to donate my kidney and how low risk that actual process of it was. That's one reason why I wanted to share that with others so that I can inform them, educate them, and maybe even encourage them to look into living kidney donation or speak to others about it in the hopes that more people are going to donate. The other fact is, Dan, that kidney donation has been going on for 60 years, and there's still a lot of people out there, kidney related people as well, who don't know an awful lot about it. And unfortunately, there's literally hundreds of Canadians that continue to die or suffer each year because of the lack of organs that are becoming available. So, I hope that by speaking to people, I can inform them and educate them. And, by joining the Kidney Foundation, I quickly became a member of the Kidney Connect peer support program, which is a confidential one-on-one matching of a donor like myself and a small army of other living kidney donors who can speak to people about their experience and answer questions, and maybe even in a way match them up according to their circumstances, whether they come from a minority or whether they're older or younger or whatever their situation might be, and they want to learn more about living kidney donation. Um, the other part, and I think there was a little bit of alluding to it, is that, the Kidney Foundation, thanks to technology in the last number of years and meetings such as these virtual meetings, has brought about many different support groups, and they meet on a regular basis. And I'm part of the Living Kidney Donor and Transplant Working Group, and it's really a great forum where I can share my experience and answer questions. But not only that, but I can also listen and learn from so many other people about their experiences. So, and forums like this are also great too. So and that's how I got involved, and it's a really satisfying and fulfilling part of the things that I do.
Yeah, absolutely. And I think, as much as you get out of it, I think your involvement, a lot of people get a lot of it from you, and that's the goal, right? Kind of just sharing those experiences and learning from each other. So I think that's really awesome. I was going to throw a question over to Aman and Olga. I see that we have one of them, and is this a good time for you guys? They're working right now. We're pulling them away, and they're working at it. So we're just there. We go.
Hi, everyone. So we were able to come out for a little bit. It's nice to see everybody. So my name is Amin. This is Olga. We both work at the transition unit at the Oakville Hospital. So it's a unit patients come to that are new to dialysis or are joining our program. So anybody that's new to dialysis, we help them transition into integrating dialysis into their life. We get patients from all sorts of backgrounds. So MCKC, someone who might have seen a nephrologist and knows that one day they might be on dialysis, so they have a bit of a background. We also get patients that are acute start, so they come from an emergency or they weren't feeling well and all of a sudden they find out they're going to be on dialysis. So with the peer support, I think it's a great program. So patients coming to us at a very vulnerable time in their life, as a lot of you guys had mentioned, you're looking for support. You get a lot of medical jargon from the doctors, we're going to do this, we're going to do that, but sometimes you just need that someone just to look out for you emotionally, just to do a check-in and say, hey, how's everything going, how are you feeling? So I think this program is amazing, and it really does help patients, gives them a space, like a safe space where they can share their feelings, what they're going through, and knowing that they're not alone. They have had other patients have walked this path, and it may not be so doom and gloomy as it might seem, but patients are doing well. And they're living their life. They're supporting family members on it, and that just because you're on dialysis doesn't mean this has to be a very negative point in your life.
Or life ends with it. Yeah.
Yeah. So I find patients feel very comfortable speaking to someone other than their family member or the care team. Sometimes, they want to ask difficult questions, or they want to ask personal questions, and they don't feel comfortable sharing that when other family members are there. It's almost better to have a friend so they can be open about their feelings, and have somebody there to kind of help guide them through their feelings.
And share experience too.
Yeah. So usually when they come to us, if a patient, we encourage them to go through the peer support program, but sometimes they're not ready. I know, as Loy had mentioned, you're so overwhelmed with what's going on, you're just not ready to hear or ready to do that. But it's for us, I think it's really good that we introduce patients and let them know that that support is available. So when or if they are ready, or they feel like they need to speak to somebody, know that something is there available for them.
And what's some feedback that you've gotten from your patients about the Kidney Foundation support
Most of
program?
our patients are who did peer support. They did like it. They did. They told us that it really helped them. Really giving them sense of belongings, and they make friends, they express their feelings, they share their stories, they share their experiences, and they like the fact that it's not only just gathering and talk. They told us that they like the fact that those groups are having activities together.
Or they make friends, and they can they can do other social things, social gatherings, they can go out. It's not just always structured. So, hey, let's just go out for coffee, I just want to talk, or I just want to get things off my mind. So they really, that was one main thing that they really liked about it.
So they really think that it helped them coping with everything, especially at the beginning.
Yeah, absolutely. Well, thanks for sharing that. Richard, do you have something to add to that?
Yeah, I just wanted to interject real quickly. A couple of people mentioned that they couldn't hear me very well, so I'm wondering if people can hear me better now.
A little bit.
Yeah, I can hear you okay.
Yeah, and I also wanted to add to what Olga was just saying. There's a sense of, well, when you're at a doctor's office and you're speaking with your medical team, there's a lot of medical jargon. There's a lot of concepts and things going on that you may not immediately understand, not to mention the stress of dealing with the chronic illness and all that, and then having to explain to family and friends and them asking questions. The biggest feedback I've ever gotten from participants in the peer support program is clarity. They join a group, and whether they participate and talk or just sit back and listen, things tend to fall into place. And I think that's the number one thing that I feel that a lot of people get out of peer support is that it just helps them to sort out everything they've learned and to sort through their thoughts and all this new information in a way that is not stressful. And it's probably worth mentioning too that a lot of people in peer support are avid participants, and they love to chat and ask questions and give feedback and share their stories. And others prefer to just sit back quietly and just listen. And I think both of those groups equally benefit from being part of the peer support community because they're getting the support they need in their own way.
Yeah, Lloyd, go ahead.
Yeah, thanks a lot. As I think back in terms of my time when I first started peer support, I had just started dialysis, and the biggest thing that I felt coming from those group meetings early on was hope. That there's hope in having a robust life. There's hope that I hope to get a kidney transplant. There's hope that I might be able to find a donor. All these possibilities now seem true because I'm hearing others talk about getting a kidney, whether it's through the deceased through the deceased waiting list, or they found a donor themselves, a family member, or they had some challenges with their dialysis and this is how they were able to overcome it. There's just a lot of hope that I was feeling early on, and it really just created a lot of momentum. And I still go to peer support myself. I feel like there's still a lot of value that I can add, but then a lot of value that I can receive. Because this journey is for life, this kidney journey that we're on. Thanks.
One hand clap floating through space.
Yeah.
I mean, I'm just gonna kind of pivot a little bit, and I'll ask I'll ask the whole group here because you guys all do peer support and the groups and stuff. What do you think some of the common misconceptions about the Kidney Foundation or the groups might be, and what do you think might hold back people from joining?
Yeah, I can, if it's okay, I can say a couple things.
Absolutely.
I think there might be some pressure for people to want to share their journey as they join these groups, and it's far from the case. The facilitators of these groups are always welcoming new members and telling any member if you don't wish to participate, that's quite okay. You can just observe and listen. And I think that really ensures that people do feel welcomed, and when they're ready to contribute, they will contribute. And I think that's really, really important.
Yeah, absolutely. I think that echoes what Richard said a little bit. Ducky, do you want to add to that?
Yeah, I was just going to say, I have, Bob's brother, he is a caregiver for his wife who's been very, very ill. And she's in the hospital right now. She one time just was reacted to her own blood transfusion. But anyway, Danny, trying to convince him that he needs peer support, and particularly the caregivers. And no, I can do it on my own. I said, oh, Jesus, you're just like your brother, so stubborn. And why? When it's such a good, I told him, I said, I am so grateful for them, for what they've gone through, and I'm still going through. So Dan, Dan, there we go. He just, they have no kids, they have nobody else. And he just won't do it. And I think it's maybe it's just a private issue more than taking that leap to the first time to call. And then because I know then he'd probably get hooked on, like me, for all the information and stuff that he can deal with. Because we used to talk a lot. I'd come home from the hospital after seeing Bob, and then, we'd have a lot of communication. But so I just wanted to say that, whether they can be so damn stubborn, I can't get him to do it. So who else am I going to get to join groups, But anyway, I'm there to try. And there's another lady at church, actually, she's going through so much frustration too with her husband that's just started on dialysis. And I've told her, join the group. We need it. We can't do it alone. So.
Yeah, it really is a community. And I think that's probably the biggest thing it offers. Richard, do you have any things to add about common misconceptions?
Yeah, and I think, well, Ducky made me think of this just now, that in joining a group in the peer support program, some people are very private, and that's understandable. And that would be a reason not to join a group, just because you don't feel like sharing your experiences, or rather you don't really want to expose yourself, you feel vulnerable. But in every group, confidentiality is very important. You only share what you want to share, and privacy is respected. So these groups are very good about that. Like I said, some people are very extroverted when they join a group, and they're all in, and they join every week or every 2 weeks or whatever the group is. They're always there. And others will just join a group irregularly and just participate little or not at all. So no matter what your privacy level is, no matter how you feel about your kidney journey, I think there really is a place for just about anyone in peer support. Whether you're outgoing and talkative like me, or whether you're very quiet and very withdrawn and feel very, very private about your experiences.
Yeah, I think that's really well said. Aman,
Can I
did you
add
want
something?
to add to that? Yeah, go
Yeah.
ahead.
So we get a lot of patients, at the beginning of the journey, right? So where they're really emotionally charged. I mean, at the hospital, we try to provide what we say holistic care. So not just medically, not just looking after their signs and symptoms, but also emotionally. And I think a lot of times patients and family members don't give enough attention to that. And I think it's very important. So to have such a program that addresses those symptoms, addresses the emotional side of it, I think is very important. And it helps if you're emotionally stable, I guess it also helps you to deal physically with whatever you're going through, and also with family members, not just patients, but family members for them to offload some of their stress and just kind of talk about it. So aside from the medical part, I think this program really does address the emotional feelings of a patient.
That's really interesting. And do you think that is somewhat new, that kind of holistic approach for healthcare? Or like, have you seen that kind of change along your career?
I have actually. I think it's a lot more to do with the patients that are coming in, kind of changing their mindset. Because for years, it's always been you go to the hospital and it's always for medical reasons. It's always, I have this problem and I treat it with this. It's not really factoring in, like I said, emotions and feelings. I don't have a medication or a treatment for that. But the treatment for it would be to speak to somebody, to have somebody. So now when we have patients and we involve this type of care, patients are new to it. So because it's a new concept, they might be a little, apprehensive of going to these groups or talking to, other patients about it. But the integration, like we are integrating it now more and more into our program, and I see the benefits of doing that.
Yeah, absolutely. Richard, go ahead.
Yeah, I mentioned earlier that my experience with the Kidney Foundation goes back decades, and I'm having some flashbacks to my time way back in the day in Toronto, when the Kidney Foundation, it wasn't even called peer support. I don't know what it was called, to be honest. But my first experience as volunteering for the Kidney Foundation was basically, I would get a phone call from someone at the Kidney Foundation, and they would ask, hey, there's a family that's coming to Toronto General for whatever reason to see a nephrologist, either for a transplant workup or for dialysis or something. And they'd like to speak to someone who isn't a doctor. It's like, okay. And conveniently, I lived very close to Toronto General. I lived in downtown Toronto for many years. And they would ask if I was available to just sit and have a coffee with them, so that they could ask me the other set of questions they had that didn't involve, medicine. And that was the origin of my experience with the peer support program. And fast forward to today, that kind of thing still exists with peer support. You can still have a one-on-one conversation with someone who will just either listen or answer questions based on their own experiences, or have a more in-depth conversation about everybody's experiences in a group setting. So really, for me, nothing has changed as how peer support works. It's just expanded tremendously over the years, which I really find to be a wonderful thing. And for me personally, I've enjoyed it because I've gotten to meet more and more people over the years, and I've gotten to learn more about myself and my kidney journey. So yeah, I'm being reminded of all these things just in this our group right now, about all the reasons why I continue to be part of the Kidney Foundation. There's no escaping this. I'm stuck for life, but that's okay, I guess.
And that's why this is a fireside chat, so we can all remind each other of the things that we wanted to say and the things we wanted to ask. Bob, I'd love to hear from you, kind of your perspective from a donor. What were the key benefits to joining? How has it kind of changed throughout the time you've been coming to these meetings? What has your experience been?
Well, I guess first of all, how it's changed. It's most of the changes has been over the last few years, really, and it's thanks to the technology that I talked about earlier, with the ability to virtually meet like this and have these support groups and get together with people, most often virtually, but also getting together in person. I'm also part of an Ottawa region support group with the Kidney Foundation, and we just got together we tried to do it annually now, and we don't get everybody that's a member of the actual Ottawa support group in the one get-together meeting. Often that's because some people have health problems and are somewhat reluctant to get together in a group, and that's why these virtual meetings that we're having right now are so good. What was the other part of your question there, Dan?
I guess then, like, how specifically, like, what are the key benefits to you for receiving peer support?
Well, I'll be honest, myself, I really enjoy participating in these things, but I don't have myself peer support for myself. The peer support that I'm giving is really for somebody on the other side of the fence, if you like, who are looking to receive a kidney or are looking to get information from me about my experience. But I'll tell you, I'm so passionate about trying to spread the word about living kidney donation that when I do speak to people about living kidney donation, there are some benefits that I like to tell them about that, maybe a lot of people really aren't aware of. And if they were, they might look into living kidney donation and maybe even, go ahead with it. First and foremost is the fact that, really it is tremendously low risk. Kidney donation is far less risky than what many people do on their weekend hobbies. Many people don't know that kidney surgery is often for the donor something called laparoscopic surgery, which is almost like laser surgery. And the recovery is really quite quick. People are released from the hospital within days. They're back on their feet and doing almost everything that they've ever done within a month or so. And what I really found was really good about it was when I talked to my employer about it, I found out that my employer, like many employers, are very supportive, and they not only gave me the leave for the time that I took off to donate my kidney, but they also covered my salary as well. There's a lot of tests involved with kidney donation, and people may think that that's expected, but what they don't know is that the risk to the donor is paramount to these programs. And if during the testing they find anything that puts the donor at any kind of risk, they're disqualified. And while it took me maybe 6 months to go through my testing, there are some programs, for instance, here in Ottawa, where people interested in donating who time is a factor for them, they can actually get all of the testing or a lot of the testing done to donate a kidney in one day. Lastly, I guess, some of the benefits or information that people don't know. It may be hard to believe, but living kidney donors, studies have found, actually live longer on average than most people. So Those aren't really the kind of benefits maybe that you were looking for, Dan, but those are the things that I try to share with people, because I just know that if people had a better understanding about it, they would look into it more and probably even proceed and help somebody by saving their life or improving their health.
No, I think those are great answers, and
Yeah.
I'm not looking for anything.
Okay.
I'm just happy to be interviewing you, lovely people. So I think that was
Okay.
a great question. Ducky, you wanted to add to that?
No, I think he pretty well said it all, Dan. Like, it's just, we learned so much, and it's just a great group to be with.
Yeah, yeah, absolutely. I think I'm just gonna maybe just start peppering in some Q&As from the audience. I think we can keep this loose. One question we received from Guy Lane. I don't know if I'm pronouncing that right. I hope so. But the question is, are your support groups virtual? Are your groups provincial or municipal? So I think this is a great time to mention that our groups are national and they're constantly expanding. So, we were just on with BC, who has an amazing program. They're starting out up there. And although often our support groups are local and virtual, and sometimes we do have in person as well, like that's something we're starting to reintroduce. Um, often you get to talk to people across Canada who are dealing with a lot of the same things as you and get a much bigger perspective. So, I would say that wherever you are in Canada, look up and see if there's a support group near you. And if there isn't one, maybe start one, because, we would love to offer you the resources and help out. Like our goal is to reach everybody. So that's a great question. And yeah, and again, just touching the virtual to physical, I think you'll see more and more in-person meetings, but virtual is not going anywhere, and it's just a great way to connect. The busy world, and I'm sure we're all doing our own things. So it's nice that you can do those things, like hop in for an hour and talk to people, and then kind of hop back out. So anybody have anything to add to that?
Well, I was going to add that COVID was kind of a strange blessing because everything went virtual, but by virtue of that, the outreach has been much more tremendous. We were in a group just yesterday, a peer support group yesterday, and we had someone from Winnipeg join us. I think we had people from all over Ontario, and I think we had one person joining us by phone from Michigan. So being able to really fine tune this virtual meeting thing has really helped to expand the outreach for the peer support program.
Yeah, you don't need to be where everybody else is. We're all talking about pretty universal things, and not specific to our hospitals. Honestly, the amount that I've been involved in meetings where we don't really talk about our hospitals, we don't really talk about our doctors that much. It really is the more universal things.
Some topics are completely universal, doesn't matter where you are. Topics about diet and exercise, things like that. Like, I don't know what I can eat or what I can't eat anymore. Does anyone else have this experience? Name it. But there's just so many day-to-day topics that people share that it's wonderfully universal that way. So yeah, it doesn't matter where you are.
I think if I might just jump in there, Dan, another really good thing that I appreciate with the virtual meetings is, unlike the in-person meetings, you're able to jump in and out as things interest you, or perhaps something comes up and you've got kids or distractions, and there's no real problem just jumping in and out. And that's a real benefit to these virtual meetings.
Yeah.
I would also add, oh, sorry.
No, go ahead.
I just wanted to add also that the meetings, because they're virtual and there is an opportunity for a wide audience, there's many people that are on different areas of their kidney journey, whether they've already been transplanted, they're doing dialysis, they're about to do dialysis, or they're a caregiver, Bob's a donor. There's a swath of different people that are usually on these calls. And, I remember when I first started peer support and I was just starting dialysis, And one of the things that I was always curious about is like, what's transplant like? And there was always somebody or a few members that had already been transplanted. And I was able to just ask questions about that process and their experience. And it was a really amazing thing. I felt so comforted just hearing from them. And now that I'm transplanted, I'm now rooting others, you know, in terms of their dialysis journey and moving on to transplant. So it's amazing.
Yeah, I also love telling people to bring their extra long charging cable for after transplant.
That's
Little tips and tricks, right? Things that maybe you wouldn't quite, think about. So go ahead, Doug.
I think a lot of people should know too that there's a month about that there's the day peer group supports and the evening ones. Maybe a lot of people don't know that they have the two for the working people, then the evening one. Mind you, it does interfere with baseball season, but you can record. But yeah, so I don't know if everybody knows that there's the two choices usually. So just thought I'd throw that in for the peer groups.
Yeah, absolutely. One thing I wanted to add too is that, along with donors and caregivers and patients, we also have quite a few guest speakers. And no matter where that guest speaker is speaking, whether it be BC or Ontario or the rest of Canada, we can all kind of tune into that. So it's actually really interesting to see sometimes when an expert will come in and what they have to say, and it's a really good opportunity to learn a lot. Okay, well, we have another question here. This one specifically for Bob. We have a question. Did you ever hear how your recipient was doing with your kidney, and have you ever contacted them or been contacted?
Yeah, that's a really popular question. And as an anonymous donor, things have changed over time. I donated almost 15 years ago. And at that time, when you donated, there was basically an agreement that you would not be getting in touch with the recipient and vice versa. However, immediately after my donation, I let the program know where I donated that should the recipient at any time wish to communicate with me or reach out and those policies change, I would certainly be open to speaking with them and getting to know them. I would have loved to know who it was. I did find out that the actual transplant itself was successful. And a year later, I received something in the mail, and there wasn't a name on it, but there was a birth date. So I found out that way that they misdirected it to me, and the person would have been about 35 years old or so. And in my follow-ups with the program after donating, I would ask from time to time how they were doing. And so for that first year or so, I found out they were doing quite well. Since then, I'm back home. I donated in Vancouver. I went to Vancouver for my donation. I'm back in Ottawa area now, so I don't keep in touch with the program where I donated, but hopefully they did well. And you don't always have that interaction when you don't know when the recipient and donor are supposedly anonymous.
Yeah, that's really interesting. That's something that comes up a lot in our groups as well. People are very curious to know about whether there's any kind of communication. And I think, yes, sometimes if it makes sense. And, you'd probably say this, if there was none, it wouldn't matter because that wasn't the point of it anyway, right? So, it's kind of really dependent on the person. And yeah, very, very interesting topic for sure. There's a question here. I think probably anybody can answer this, so I'll throw this to the table. But do people talk about decline in their diseases and end stage, and let's say some of the more serious stuff? Like, are those topics that come up during peer support? Go ahead, Lai. I know you want.
Yeah,
sure.
Yeah. In terms of decline, yeah, I mean, lots of individuals share challenges that they have. Whether it's dialysis, maybe a particular dialysis modality, they started at PD, maybe it's not working. And then, they got to think about, transitioning to hemo and then trying to figure out, what's that all about, or vice versa. Maybe they had to start hemo because it was a crash start. They didn't have that opportunity kind of to making that choice. and maybe now they're curious about PD. Everything that is shared, as you mentioned, Dan, is private, confidential, and there's no pressure to share if there's something going on personally where you are going through maybe a bit of a decline. As mentioned, there's a whole swath of different patients going through different kidney journeys. Those that are on the cusp of trying to decide what dialysis to use. They may be the ones that are really just trying to hone in on what is best for them at that point, and just sharing where they're at and some of the symptoms that they're going through right at that point as well. So that would be my take on that.
Yeah, go ahead, Bob.
Yeah, so it's almost 15 years now since I donated, and people do wonder about my health. And I'll be honest, I haven't had one health problem, and I'll touch wood on that as I say it, since my donation. And I've been very healthy. I play hockey twice a week. I swim. I'm as active today as I was when I donated, which was very active at the time as well. And as I mentioned, living kidney donors actually live longer on average than the average person. So it's very low risk, and you're well looked after. One of the benefits also to living kidney donation is that you're followed for life. You have an annual checkup every year that goes through not a battery of tests, but goes through a number of tests just to ensure your health. And if there's anything that comes up, you're looked after, and they'll pay attention to you. So yeah, my health is really good, and most living donors are in the same boat.
Yeah, I think that's a really good point. And, generally we do ask during our meetings that we maintain a pretty positive tone. A lot of the things, as most of there's a lot of trying moments and that sort of thing. And we don't want people to move away from that. But it's supposed to be an area where you can speak freely, you can say what you mean, and you don't have to worry about someone taking it in a certain way. And then what we always have, if someone's going through a particularly hard time, we do one-on-ones and follow-ups. We have medical or people who are part of the Kidney Foundation, maybe just past the volunteers who can follow up and might have more knowledge on the situation. So there's so many people that are able to address you specifically if there's something that you want to come with that is maybe a little bit harder a topic than we're kind of reaching in a group. So you don't need to shy away from those things, that's for sure. Go ahead, Richard.
Yeah, I just wanted to echo what you just said, Dan, that there are many resources and many different people with many different experiences, and all of the feedback and all of the discussions we have are all grounded and based on the knowledge that we've accumulated collectively. And there's no topic we haven't discussed. Everything and anything you can think of related to your kidney health is covered, even if it's a difficult topic to talk about. So yeah, there really is, even after all these years, I myself keep learning new things and discovering new things that I never would have thought about. So yes, for that question about, do we speak of things about end of life or end of life care, or I was reading the question itself, maybe concerns about your kidney health as you get older. Yes, absolutely. Those are topics that would be covered in any peer support group.
And Aman, I'd love your take on this too, because I imagine that you need to have these conversations quite a bit with patients. So, is there times where peer support can help with that, or what's been your experience with that?
Yeah, absolutely. Like I said, based on where I work, it's a lot of it's kind of medical related questions, right? They want to know, what are my numbers, what's going to happen, what are my signs and symptoms. But I think it's very important to also address non-medical questions. What if I were to, what does maybe end of life care look like? If I want to go conservative, what will I feel? And I think those are very important questions. And that also goes part of holistic care, so that they can make informed decisions based on their care. So knowing what to expect, knowing what's going to be out there. So really talking to them about not just the positive things, if there's such positive things on being dialysis, but also things that they might not want to address. So, like I said, conservative care, or how does end of life? What if I just want to treat with medication? I don't want to be on dialysis. They are difficult questions, but I always welcome them because I find patients are kind of looking at the bigger picture. And the more information you have, the more open you are about receiving information, the better decision you can make, and better integrate dialysis into your life.
Yeah, that's a great answer. And, it must be interesting, being a healthcare worker in a time where people have so much access to their own, labs and that sort of thing. And do you find that is a positive thing where people can talk about it a little bit more freely and they have a little bit more education?
Yes and no. Yes, I think it's good that they're more involved. They want to know what's going on. They are exposed to a whole lot of information these days. Dr. Google. They want to go know everything there is to know about their diagnosis, but also make sure you're going to the right source. Make sure you're getting the right information. There's a lot of stuff out there. So maybe even speaking in a supportive group like this, you're getting the right information. You're getting information from people who have actually gone through it, or they might say, I don't know, if you do 10 jumping jacks and stand on your head and you'll cure yourself. And, you'll definitely say, somebody will say, no, that's not right. Or you need to check your sources. So, yeah, so having the information there available to you is a good thing. It keeps everybody connected to their care, able to make better decisions, but also make sure you're getting the right information and it's coming from a credible source.
Yeah, the old Google MD, right? Yeah, it's good. It's good to discuss with other people to realize that everything you read on the internet is completely true. No, I'm kidding. Not true. Not even close. It's really good to both talk to, real professionals about it, and then people with lived experience, right? Because those are the people that are going to know the best out of anybody. So we have a few more minutes left. So I'm going to ask one more question to all y'all, and keep it quick. So, Richard, in one sentence, what keeps you coming back to peer support?
I think I get out, I receive, or I get from peer support what I give back. In other words, it is as helpful to me as it could be. Boy, let me start all over. I benefit from it as much as I hope I benefit others from it.
I love that. How about you, Ducky?
Me? Well, I just love listening to the people. And if I can give any of my advice and experience how peritoneal dialysis suited our lifestyle, because a lot of the meetings, there's people that are trying to decide what kind of dialysis they want to go on. And then I just like to be able to give them my opinion. And actually, Dan, you said one of the questions was that, what shall I say, the oldest person that's had a kidney transplant, I think he was either 86 or 87, and depending on all your health issues and whatnot. But that just kind of marveled me when heard that to receive one at that age is pretty magnificent. So that's encouraging for other ones that are trying to make a decision if they're concerned about their age at that time. But and as I've told a lot of people, my philosophy in life is you've got to have bad days to appreciate the good. So that's what I've always felt, and that's all I'm going to say, Dan.
That's great. Thank you, Ducky. Loy.
Yeah, it's definitely, I want to just piggyback on Ducky. It is the people, but specifically a lot of the people in the Kidney Foundation are kidney patients as well. It's incredible to think about, the amount of work it is to put programs together, to put people together, and all these great, wonderful people in the Kidney Foundation. A lot of them are kidney patients themselves that have gone through quite some journeys, I would say, to put it lightly. and they're all inspiring. And for me, just to come in and just to give a piece of my story of my kidney journey, it's the least I can do. And I feel for all the patients as well. And the bonds that you can create with some of the patients can be really, really incredible. So that's it for me.
Bob?
Two things. It's getting to see everybody every monthly meeting that we have, and hear their stories and get to know a little bit more about them. And then secondly, it's the hope that people listening and seeing me will actually look into living kidney donation and either proceed with it themselves and donate a kidney, or spread the word about living kidney donation. And that's basically my reason for sticking on.
That's great. And I'll rephrase it a little. Why do you keep sending people? Why do you keep sending your patients?
I guess I really do see the benefits of looking after patients' emotional beings. I find patients who actually do have someone to speak to or share their thoughts are a bit more open to what is to come, and they're a bit more, I don't want to use the word stable, but you get a good grasp of what's going on, and sharing your feelings, sharing your journey. Not only will it help others, but it helps you as well. So I think it's a great program. So that's why I always refer my patients.
Thank you. And there's one more question. I think it's a really good one to end on, and I'll just kind of touch on it by myself. This person's asking if it's ever too early in their kidney journey to join. And the answer is no. There are tons of different groups that are living with CKD, living with low functioning kidney, diet, cooking classes, you name it. It's never too early to join. I think information is power, and you'll find a group that's right for you, that are in that kind of line with your journey and can help you along that way. And honestly, maybe you can help someone else along their way. So I'm going to wrap this up for now. Just please remember, for joining and finding more information about all of these things, go to kidney.ca. We have group calendars that you can see when each meeting is, and that's nationally. It's updated every month and has new times and dates, but they kind of stick to a schedule. Also, you can connect one-on-one with someone no matter what you're experiencing, and you can find someone with that live experience. So please reach out if you do need help, or you just want to find out more information or find out what's right for you. And just remember that you're not alone in this journey, and that's specifically what this is for. It makes a huge difference, and having people to discuss your journey with it gives you more hope, and at least it did for me. And it was just a really powerful thing to have. So thank you all for joining. Thanks to all our guest speakers for sharing, just these personal things throughout their journey. And please join us for a movement break coming up. I'm going to do it. We're going to do some jumping jacks and rub our head, right? Is that what we said? And then we have a bunch more today too. Anything from cooking classes to networking sessions to a caregivers class. So stick around. Please join us all for the rest of the day. Thank you so much for joining.